Hi, my name is Lynn Gallowbeck. I am the nursing team leader for orthopedics on the 6th floor. We have 22 all-private rooms on 6 North where our joint replacements go to post-operatively. And then we also have 6 more privates on 6 Zone 1, which Judy Haynes, my boss, nurse manager, and myself oversee. So that's where you'll be going to post-operatively. So the purpose of this class is really just to answer any questions that you might have regarding surgery, coming to ECMC, and maybe alleviate any fears that you might have too. It's we encourage you to ask any questions that you might have. We'll have myself from nursing here. We will have physical or occupational therapy to do their portion of it. Respiratory therapy will be here, and also discharge planning. Okay? So inside of your folder, you're going to find the book on the procedure that you're having done, the knee. There's some information for Meals on Wheels also. It might be something that you need a little bit of help with post-operatively. So we do put some information for Meals on Wheels. There is a list of Erie County rehab facilities also in there. You may need rehab post-operatively, and it's something that you probably have discussed with your doctor already, if you need it or not. Have you chosen a place already?
I'm going to go home and
You're
do
going to go
outpatient.
home.
Yeah,
Good.
I've already
Okay.
talked to a therapy group.
Okay, that's
about
good.
it,
So you've got yourself
you got
set up.
exercise and everything else.
We also, the discharge planner will talk to you about the need for rehab post-operatively too. Every so often we do have someone who's fully intended to go home and then needs rehab. So what we do is encourage you to take a look through there and see if there's a place that you'd like to go to, and call and pre-apply. It's kind of like a hotel reservation, and if you need it, you have it. This way it's set for your choice. If it's something that if you don't do it, it's not a problem, we would set it up for you post-operatively. Might just not have the accessibility to your first choice. Okay? And then if you don't need it, which is what your intention is going to be, our discharge planner takes care of that, of everything else from there. Okay? There's also a healthcare proxy in there. I don't know if you've got one already, but there is a big push for healthcare proxies. If you do have one, bring it with you, and we'll make a copy of it and give you back your original. If you don't have one, you can take that home, fill it out, bring it into, don't sign it. Your signature has to be witnessed by 2 people, not yourself or your proxy. So bring it in unsigned, and then we can take care of it when you come in the morning of your surgery. Okay? So when you come the morning of your surgery, you're going to be going to room 160. 160 is on the first floor. When you enter the hospital, you're on the ground floor. And it's also where you would go for your pre-op testing. And that's the surgical waiting room, so that's where you'll be going to the morning of your surgery too. When you come the morning of your surgery, you need to bring your picture ID and your insurance card with you. Okay? They will give an ID number for your family to follow your progress on a big screen board down there. They'll take the patient in the back, get you set up in a gown, and then usually they do let your family come back in with you. They call it minimal separation. They want you to be comfortable, and normally your comfort's with your family. So they will let your family come back in with you. You'll meet your surgical nurse, the anesthesiologist, and then also your surgeon's going to come. He's going to confirm with you one last time what he's doing, left knee, right knee, and take a Sharpie and label the body part that he's doing. At that point, he's also going to let your family know how long it's going to be. Usually 2 to 3 hours, but he's got a better idea of how long he's got slotted for you. So he'll let you know how long it's going to be. Okay? Then we just ask that the family be in the waiting room waiting for the doctor when he says he'll be out, so that he can let you know how everything went. Okay? We usually give you, we're able most times to pre-assign a room on the floor, so the family will know where you'll be going to post-operatively. This way they can bring your belongings up to the room and leave them in the room. When you are awake enough after surgery, come out of anesthesia enough and feeling okay, they will let your family come back in with you also at that point. They call it minimal separation again. They want you to be comfortable. Once you're all set and you're awake enough and recovered enough, we'll bring you up to the floor. So the nurse that's been taking care of you down there will call upstairs and give a report to the nurse that will be receiving you on the floor. Transport will bring you up in the bed that you're going to be in, and take you into your room. At that point, we'll do a full head-to-toe assessment, concentrating on the area that you've had done. But we want to know if you have anything else going on. Maybe you're struggling a little bit with your arm or your shoulder, and using a walker might be difficult for you. Also, if you have anything going on as far as skin issues, if you have any rashes, any cuts, anything going on that we would want to know. We're going to find that when we do our assessment, talk to you about that. Okay? In the private rooms on the floor, there is a reclining chair, and then there's also another chair in there that folds out to a twin-size bed. If you would want your family to stay overnight with you, they are more than welcome to stay overnight with you to spend the night. If that's how where you're going to be comfortable, that's fine. We do have that there for them. We encourage them, them to stay if that's what you want them to do. Okay. So usually you're overnight for a knee. You're usually overnight with us 2 nights, sometimes a third. Every so often we have a knee that goes home on post-op day 1. It does happen sometimes where people are doing so well. We know you're in a lot of pain already, so we know that if that was the case and you need to you're struggling with pain, so the pain post-operatively might not be so bad. Okay? All right. So the morning, you're going to be given 2 times from your physician to come here. Your arrival time and your surgery time. You're not going to have anything to eat or drink after midnight the night before. There'll be a list of medications in your folder, in your booklet, of what to stop before surgery. If you're taking any aspirin or Motrin, any multivitamin, fish oils, there is a list of medications that you do have to discontinue, and your doctor will give you the instructions on that also. When you're here in the hospital, we're going to be giving you 3 doses of IV antibiotics. The first dose you get in the recovery room, and then you get 2 more on the floor. We'll give you some type of an anticoagulant, a blood thinner. We want to help prevent blood clots. Another thing we do for that too is sequential compression device. These are hooked up to a machine that sits at the bottom of your bed to instill air. We still see sometimes the one that goes across the whole bottom of your leg, it goes around your calf, but we're seeing more and more of TED stockings and a foot pump. Again, this instills air to promote circulation and help prevent blood clots. We're going to be giving you some type of a colace or a stool softener. We want to help prevent constipation too. Pain medication and immobility can slow the motility of the bowels right down. So we do want to do what we can do to help prevent constipation also. Okay? And then we're going to be giving you your own home medications. We ask that you don't bring any of your own medications with you. We'll provide them for you, along with everything else that we'll be giving you here. We'll be giving you something for pain too, to control your pain. We want you to be able to work with therapy. We're not going to take your pain away, but we do want to make sure that we're doing what we need to do to control your pain, to at least get you through your day. On page 7, there is a list in there of medications for you to use to fill out for your own home medications. And that way too, you're not forgetting any over-the-counters. So we're making sure we're giving you everything that you've been taking at home that the doctors want you to continue while you're here. At ECMC too, we also do purposeful nurse rounding. The hours from 6 a.m. to 10 p.m. at least every hour, somebody from the staff is in to see you. We want to foresee your needs. Are you comfortable in the position you're in? Is your pain medication due? Are all your possessions within reach? Do you have your glasses and everything else that you need around you? And also, do you need to get up and go to the bathroom? So at least every hour someone will be in to see you. During the night, it's every 2 hours. Most knees, like we've said, go home now. We're seeing more and more people go home and not rehab. We will set you up with in-home PTOT to assess you and see what you need. The nice thing too now with most knee surgeries, we're seeing what's called an aqua cell dressing, and this is waterproof. So this you can shower. That's a nice thing. You can't submerge yourself in water, but you can't take a bath or go in a hot tub or a pool. but you can shower now much earlier, right away actually, in comparison to having to wait days to go. We are seeing less and less Foley catheters on the floor. The doctors definitely want to encourage early mobility, and part of that is helping you get up and use the bedside commode. But if you do wake up with a Foley catheter, we just don't want you, we want you to understand that you may. We also have soap, shampoo, toothbrush, toothpaste here. You don't need to bring your own with you. We do have everything here that we can provide for you. Okay. Doctors also, you'll get it from your surgeon. Recommendations on dental prophylactics. It is recommended by the ADA and AAOS that you do take some kind of antibiotic prior to any dental procedure. Some of the physicians do recommend that you don't have any dental work done for at least 6 months. And then as far as the timing on how long you'll need to take them for would be up to your surgeon. So just make sure that you check with your own surgeon as to how long you need to wait to go to the dentist and how long you'll need to take the antibiotics before any dental work is done.
My name's Andy, I'm from Respiratory Therapy. I'm just going to do a quick overview of this breathing device that you're going to be using. Okay.
No.
You know this? You probably could teach me then, right? All right. So this is an incentive spirometer, right? And we use this to make sure that after any procedure, whenever you're laying in a hospital bed, you take a nice deep breath, keeping those lungs nice and inflated. And so we want to see you use this to make sure that we're preventing you from having to stay here any longer than you need to, right? So you saw it attaches like so. This little blue marker here is going to show us how much volume you're able to pull. Okay, so, and then this also extends out so you can see a little bit better. You're going to take a nice slow deep breath in through this mouthpiece here, just like you're sucking on a straw. So when you do that, you're going to see that blue marker move up, show you how much volume you're able to move. You make that thing go as high as you possibly can. Okay. On the right hand side, there's 2 arrows here. It shows you how fast or slow your breath is going. You want to try and keep that marker in between the 2 arrows. Okay. So why don't you go ahead and do a couple practice runs. Good. Deep all the way to the top of your breath. Good. The very top where you want to hold for a couple seconds, and then release. Okay. So that helps making sure that our lungs are inflated as much as possible, so that we're keeping, especially the lower areas of the lung, where when we're laying in bed, we're not moving around, they start to collapse a little bit. Also, when you do that, you may cough spontaneously. If not, we encourage you to do a few coughs when you're doing that as well. Okay? You can take this home with you, do some practice runs, make sure you've read that before so you know, but make sure that everything's working okay. Leave this at home. When you come in, there'll be a new one sitting on your bedside table when you get to the room. We encourage you every 1 to 2 hours while you're awake. Pick it up, 10 breaths, a little bit of coughing, and then as you are starting to move around more, you can start to decrease the amount of time you use this. But you can't use it enough. Keeping those lungs nice and inflated, okay? Any questions? No? Okay.
Thank you
Very much.